Hi everyone, Thomas Weimbs here, the president of Santa Barbara Nutrients. It's a great pleasure to have Manfred here to have a conversation with. I thought you guys might enjoy the story that Manfred has to tell. It's a little bit unusual in the sense that mostly we have been dealing with people before kidney transplantation, maybe before end-stage kidney disease. And that's the whole point of KetoCitra and the nutritional and lifestyle changes to slow the progression of the disease or maybe stop it, so that people don't necessarily have to go all the way into end-stage kidney disease. But Manfred is already past that point, but has still decided to do these dietary changes, use KetoCitra, and I thought we'll hear from him today how that goes. Hi, Manfred, welcome.
Hi, Thomas. Thanks for the invitation.
Yeah, absolutely. So Manfred is in Germany, speaks mostly German, but luckily agreed to do this in English. Let's do it. Manfred, maybe could you let everyone know maybe a little bit about your history with PKD, how you were diagnosed, whether there was a family history, and how the progression of the disease went, all the way to your transplant?
Yes, of course. Yes, I knew about the illness, about the cystic kidneys from my father. So I did some life changes mid-20s, blood control, blood pressure control. I lived almost as vegetarian and were jogging on a daily basis, so to do something, but the knowledge was very little. So that's all. And so the illness increased up to terminal state. End of 40s, I get fortunately the kidney of my wife as a transplant. And after the surgery, the doctor told me the kidney will decrease gradually over the time. The best result was the filtering value right after the surgery, and so it was a little bit above normal value. So that was the history. During this time, I got some punctuations because of the abdomen pressure. And maybe I have to mention that I knew the cystic kidneys are autosomal dominant, so both of my children had it, and they knew it. So that was the story.
Okay. Right. Okay, great. Maybe a recap real quick. You had PKD with a family history and, the usual progression towards end-stage kidney disease. At that time, then luckily, your wife turned out to be a suitable kidney donor. And you got essentially a preemptive transplant, so you didn't need to be on dialysis ever.
Yeah.
So you got your the transplant, while your kidneys were still functioning. Now you have your wife's kidney in you. So you actually have 3 kidneys. So there are people with 3 kidneys. So you have your 2 native polycystic kidneys in addition to the good kidney from your wife. And your transplant doctor had already told you to take good care of the good new kidney, because even a transplanted kidney will slowly decline in function over time,
Yeah. Yeah.
and you wanted to slow that down as much as possible or prevent the decline. Good. Yeah. So I think a lot of people with PKD either are in that situation, they might be post-transplant already, or they are facing that situation. They will see, kind of transplantation on the horizon. Good. And then for you, something happened. So after you had your transplant, and you were determined to do something about keeping the transplant well and happy, somehow you found out about our research, at UC Santa Barbara. And how did that happen?
Yeah. More than 10 years after the surgery, my son sent me a paper, the paper from Jacob Torres, and it was a totally new point of view on the whole disease. I never heard that kind of research and that kind of possible treatment of kidneys. So I try to advance these new research in form of, I started with the 16 to 8 intermittent fasting, and additionally the recommended diet from this paper. Keto,
Ketogenic
ketose,
diet, right? Yeah,
yeah, and
right.
avoiding sugar, avoiding carbohydrate, and so on and so on and so on.
Mm.
All these things
Right.
at
So you
once,
did.
and
Mhm.
yeah, that was the point.
Right. Okay, excellent. Yeah. So your son brought to your attention our paper from, I think it would have been the 2019 paper, that
Correct.
where we found in animal experiments that ketosis is highly beneficial in polycystic kidney disease animal models. And in particular, a ketogenic diet turned out to be very beneficial. And ketogenic diets, are is essentially a nutrition lifestyle where you just cut down the carbohydrates to very little. And carbohydrates means sugars and starch. So essentially reduces to almost nothing, maybe like 20 grams, maybe 50 grams per day at the most. And you make up the difference by increasing usually fat intake. So that's what you decided to do, which is very adventurous. And but you also decided to just do it all at once, with kind of cold turkey, how they say here. So
Yeah.
immediately, which is even more adventurous. Um, but I think your history was that you were a vegetarian already before, right? So
Yes.
that makes it pretty difficult to do a ketogenic diet and stay being a vegetarian. So how did you actually do it?
Yeah, of course, that was not easy. It's, to get the energetic balance for the daily life, and testing a lot, and doing a lot to get this. Did it with some supplements at first, and some treatment. After a while, I got better a little bit, and additionally, my daughters told me, some better advices. So at the end, I got it. I have some supplements as well, and now already. It's like magnesium, iron, vitamin D. That's the whole thing,
Hmm.
but they are not special. That's normal things. And
Right.
magnesium had a little bit to do with the PKD things, because the
Mm.
preparation for magnesium is a little bit tricky, maybe. The doctor advice.
Mm. Right. Okay. Yeah. So you implemented with, help from your daughter, who, by the way, happens to be a researcher in my lab, for anyone who may not know. Um, So she actually knows all about, the science behind it, and she was able to tell you about oxalates. I'm assuming
Right.
because someone on a vegetarian diet, the danger of like very plant-heavy diets is, people eat things like spinach and Swiss chard and nuts and almonds all day long. And before you know it, you have a lot of oxalate in your food that then is a big stressor on the kidneys. And in our some of our other research in the lab, we have already shown that oxalate can really worsen the progression of PKD. So luckily, you had good advice, and you implemented a very low carbohydrate diet in a sort of like a plant-focused way. And you combined it with 16/8 time-restricted eating, so which means for 8 hours in the day, an 8-hour window is when you eat, and for the remaining 16 hours is when you don't eat, which is called a 16/8
Exactly.
time-restricted eating. Great.
Yeah.
All right. And of course, this wouldn't have been easy to do, and I'm sure you had some problems along the way, keto flu and so on. But looks like you overcame all this. Um, but then what happened? So I would say if you ask like 100 random kidney doctors, someone who has a kidney transplant, should they do a ketogenic diet? I think out of the 100 random kidney doctors, 99 would say, "Oh no, you can't do that. Your kidneys will fail,
Yeah.
within a week." But is that what happened? Did your
Yeah.
kidneys all
Actually,
fail?
the opposite happened. Interestingly, um, I improved my filtering values. After a while, more than 10 years, it increased as predicted, but now it decreases again. And now, some month ago, I were the first time in my life since 30 years, over 30 years, with a normal state of filtering values. So both, and there are something happened with either my new kidney, or with the old ones, or with a mix of both. I have no clue, but it works. So actually, if there isn't somebody with a transplant, do it, and you will increase the overall filtering. That's what we want to do. The overall filtering value. That was amazing for me.
Yeah,
It was amazing.
right.
Imagine you have most of your life you have you are not in the normal state of filtering values. And suddenly you are. That's amazing.
Oh, right, yeah. And I should probably emphasize for anyone watching, nothing we're discussing is medical advice and, does not replace medical advice. So um, uh, always talk to your doctor before changing anything dramatic, even with diet and lifestyle. So these things can have big effects. But for you, Manfred, the big effect was, as I understood you, is that your creatinine value, which is, routinely measured to look at kidney function, your creatinine value actually went down and down and down as you did the ketogenic diet and the time-restricted eating, and it went to a level that was better than you had in like a couple decades or so. So now you're actually in the normal kidney function range, which that hadn't happened before. So that's amazing. How long did it take when after starting the ketogenic diet and time-restricted eating until you saw these improvements?
At the beginning, there were the only effect was a steady state of kidney function, no longer decreasing. That, for me, what was a success, of course. If you um, know your kidney function will be uh, worse during the time, and suddenly it's steady state. It's a good advice, and only that was nearly a little bit more than 5 years ago. I started all the procedure the first 2 years only, after the first 2 years, I get a steady state. And the last 2 years, the kidney functions increase again. And so, and I come up from a value of 2 to 1.2 at the end. It's a lot.
Yeah.
It's a lot.
So that's amazing. I'm wondering what your renal doctor had to say about all this. Did you ask them before you started this, should I do it, or did you just do it?
I just do it
You
at the
just did it.
beginning.
Okay.
Then
Right.
after, of course, next time I met my, I have actually two doctors. One, this doctor who were during the surgery, and the other one here next door. Let's say like next door. Both nephrologen. What is it?
Yeah, nephrologists, right? Exactly.
Nephrologist. Sorry.
Uh-huh.
And the surgery advisor said, you can do it if you feel good, then do it. Be careful, look your blood values and so on. But if you were the other side, that intermittent fasting is okay, but ketogenic diet it's dangerous. Maybe dangerous. Maybe only maybe. They don't forbid me to do that, but it's not possible. But the advice was not. It's dangerous.
Right. Okay. And what did they say after you had your improvements in the kidney function values?
They have no clue. That's what the thing. That's interesting, very interesting. But maybe it's they come up with the research is not enough proven. So maybe it is ketonic or something else in your lifestyle. What we don't know. So I told them all the stuff, but they don't believe actually.
Okay.
I think.
Was they aware of our research? Did they know about?
My surgery advisor asked about this, and he denied that there is no research. I had known, and then we both looked into the internet and found these Cologne research on clinical and the Cologne clinical research with the amazing results. And he only said, "Okay, I have to read." You're right, I have to read. So let's wait. And yeah, that was this.
Good,
reaction.
excellent. Yeah, so you actually educated your nephrologist on something
kind
that
of.
maybe they should have known, but it's of course very typical. And kidney doctors, like any doctors, they're very busy. They have to see patients all day long. They don't really necessarily have time to read the literature, the primary papers that come out. They oftentimes read review articles, that put everything together, what happened in the last 20 years. But that also means the knowledge is then pretty outdated. So they don't usually have, the day-to-day, latest research. But it's a good lesson to learn for patients, to actually be their own advocate and know more about the research than maybe their doctor, and bring that to their attention. So that's amazing, yeah. And we should say, Manfred, you're working for a couple of universities. You're teaching, so you're someone who knows how to read studies and understand studies.
That's the point, yeah.
Right. That's amazing. Great. So your kidney function improved, and you're staying with the type of diet changes. You're keeping it up, and I believe you also added KetoCitra now to your routine.
For a couple of months I added it, and There is not a big change because I guess I was nearly on on ketose state, and my diet was pretty good, uh, 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 but I guess it's a little bit more energetic the whole day. It's a little bit more energetic with KetoCitra, adding KetoCitra to water to meal. Yeah.
Okay. All right. Excellent. Yeah. And your kids have PKD as well. And I understand. So you were the first to even try this approach, right? And you
Yeah.
wanted to be the guinea pig, the lab rat, to try it first. Is that how you did
Yeah,
it?
that's exactly my yeah, that was the reason for doing all that to get a start for them to be for a new lifestyle. Maybe it will help. So after some improvement, they started it as well, their own. So that was the result, a positive result for me as well.
Mhm. Wow. Yeah. Amazing. Yeah. And by now, your daughter actually joined my research lab because she is a very, very highly trained PhD doctoral level immunologist, and is doing great research in the lab. So we're, discovering new things thanks to her. Um, yeah, amazing. So, what would you say to other people maybe in a similar situation? Do you have like a message for them, or anything you recommend to do?
Yeah, of course. If you have a transplant, it's a very great gift. So treat it well and think about what you eat. It's not, and mostly they say after a surgery and transplantation, you can eat everything. That's not the truth. Don't eat everything. Uh, as you mentioned, the oxalates, it's a big deal for our kidneys, for the new kidney as well, of course. And so the thing is, we want to use the kidney for a long time for our life quality, to increase our life quality. So be careful with your eatings and take care.
Right. Excellent. Yeah, no, that's a great message to leave with. Thank you so much. Yeah, we will stay in touch, and I hope things
Thanks.
will turn out like nice and stable and smooth sailing with your 3 kidneys. So wonderful. Thank you so much for talking to me. Thanks. Bye.
Bye.